the next speaker, Dr. Sangeeta Pahuja, who is the head and professor of Department of Immunohematology and Blood Transfusion, Lady Haring Medical College and Associated Hospitals. Madam is also recipient of ISBTI J.R. Jolly Award, Hesdy Shorey Award, Eminent Medical and Health Educational Teacher Award. So with no doubt, she's going to be a great teacher today. So over to you, ma'am, for the wonderful learning.
I'd like to thank CAHO for giving me this opportunity. I would like to extend my thanks to Dr. Gupta and Dr. Shami Shastri for inviting me over. So I'll be talking on amended regulatory compliance in Drugs and Cosmetics Act. So we have been talking about quality. The blood and blood components are categorized as a drug due to their internal administration. So the laws and regulations concerning blood transfusion services are covered under Section 3B of Drugs and Cosmetics Act. So Part 10B of the Drugs and Cosmetics Rule and Part Schedule F of Part 12B defines the rules pertaining to functioning of the blood banks. So Drugs and Cosmetics Second Amendment Rules 2020, they came into the GSR 166E came into effect by Gazette notification dated 11th March. So these rules are called as the Drugs and Cosmetics Second Amendment Rules 2020. So the salient features of these Second Amendment Rules 2020 are that the name blood bank at all the places that it appears in Part 10B as well as in Schedule F of Part 12B has been replaced by blood center. Whether it is blood bank, blood banks, blood banking, or blood bank apostrophe S has been similarly changed to blood. In the Rule 122EA for Clause D, for the definition of blood bank, it has been changed to blood center is an authorized premise in an organization or institution, as the case may be, for carrying out all or any of the operations, including collection, apheresis, processing, storage, etc., and distribution of blood drawn from donors or received from another licensed blood center. This is another important addition. That is, the clause of bulk transfer has been included in the recent amendment. Then in Rule 122EA, Subrule 1, for the definition of donor, it has been added that he gives donation without accepting anything against donated unit. In return, any consideration in cash or in kind from any source. Then the new clause of erythrocytopheresis, meaning selective collection of 1 or 2 units of red cells from a donor or patient using a cell separator and retransfusing the remaining blood into the donor or patient, has been introduced in the amended rules. Then in Rule 122G regarding form of license for operation of blood bank, it has been modified wherein the operation of blood center or processing shall be conducted under active direction and personal supervision of competent technical staff consisting of at least one person who's whole-time employee and who's medical officer, and he should be possessing at least one of these 5 parameters which have been modified. Either MBBS, having experience of working in blood center not less than 1 year, MBBS with diploma in clinical pathology or diploma in pathology and bacteriology with 6 months experience in licensed blood center, MBBS with diploma in transfusion medicine or diploma in IH or BT with 3 months experience, MD in pathology or DNB in pathology. So DNB has also been included, which was not there earlier, with 3 months experience, or postgraduate degree in transfusion medicine, that is MD or DNB in transfusion medicine or immunohematology and blood transfusion. Moreover, for application for grant of renewal of license for operation of blood center, so this different color highlight are the changes which have been done in the amended rules. Or processing of human blood components shall be made by blood center run by government, Indian Red Cross Society, hospitals, charitable trust or voluntary organization, and a blood center which is run by charitable trust or voluntary organization needs to be approved by state or union territory blood transfusion council, that is SBTCs, as per procedure laid down by NBTCs. So this is another important addition that has been done. For accommodation in blood centers, which are listed in Schedule F, Part 12B of the Drugs and Cosmetics Rules. The following new areas have been added: store cum records, counseling area with adequate privacy, and identified quality control area with component preparation area. Regarding personnel in blood centers and blood components, for the previous requirements for blood bank technicians, it has been modified to, for the technicians, diploma in MLT or diploma in transfusion medicine or blood bank technology. So these terms have been added after 10+2 with 1 year experience. Similarly, for degree in MLT, blood bank technology, but requiring 6 months experience, and the term in the licensed blood center has been added. Moreover, for the blood bank technician, the further qualifications which have been included are BSc in hematology and transfusion medicine with 6 months experience, or MSc in transfusion medicine with 6 months experience, or postgraduate diploma in MLT or postgraduate diploma in medical lab sciences, again with 6 months experience. So for technical supervisor, where blood components are manufactured, then the requirements for technical supervisor have been changed: diploma in MLT or transfusion medicine or blood bank technology with 1 year experience, degree in the same with 6 months experience. The others are same as in the technician: BSc in hematology and transfusion medicine, MSc, postgraduate diploma in medical lab technology, and also postgraduate diploma in transfusion technology approved by central government or state government with 6 months experience in licensed blood center. A new clause has been inserted, that is, blood center organizing blood donation camps shall have following whole-time or part-time counseling staff, that is the counselor or medical social worker, and the requirements, that is the master's degree in social work, sociology, psychology with 6 months experience, or degree in science or health science with 1 year experience, or person with 10+2 having 3 years experience have been included. This has also been added that blood centers collecting less than 3,000 units per annum can share counselor or medical social worker within the institution. In the list of equipments in the previous Drugs and Cosmetics Act, 3 more equipment have been added. That is standard calibrated weight, equipment for TTI testing, that is ELISA or CLIA, and micropipettes if ELISA is used. These equipment have been added in the list. Regarding the criteria for blood donation in the subheading H, in the previous Drugs and Cosmetics Act, there were a very limited criteria which were given for blood donation. Now the criteria have been expanded, and it is beyond the purview of this seminar to discuss all the criteria. So now for the screening, more than 100 criteria have been given for blood donation. So many changes have been made, like for example, differently abled donors or donors with communication and sight difficulties can donate blood, provided that clear and confidential communication can be established. For the first time donors, the age is limited to 60 years. Then donation intervals for males and females has also been defined, and also the donation intervals between the platelet pheresis and whole blood donation has been defined. Now regarding blood donation camps, a blood donation camp, this is the previous DNC Act, a blood donation camp may be organized by a licensed designated RBTC, that is Regional Blood Transfusion Center, a licensed government blood bank, Indian Red Cross Society, or a licensed blood bank run by registered voluntary or charitable organizations. So the designated Regional Blood Transfusion Center, for this term, they have made some amendments. That is, designated RBTC shall be a center approved and designated by Blood Transfusion Council, constituted by state government in accordance with the procedures laid down by NBTC in this regard. Then the rest is the same, that is to collect, process, and distribute blood and components to cater to the needs of the region, and so on. Regarding blood donation camps, in subheading B, for personnel for outdoor blood donation camps, the 2 medico-social workers has been replaced by 2 counselors or medical social workers. Similarly, in the list of equipment, the portable hemoglobin meter or copper sulfate method has been replaced by portable hemoglobin meter or copper sulfate method, or any other quantitative method which can be used for determination of hemoglobin estimation.
Ma'am, next 5 minutes of yours.
Yeah. So for processing of blood components in equipment, plasma expressor has been replaced by plasma expressor or automated expressor or multi-head tube sealer. In deep freezer, the snap freezer has also been added, and cryobath has also been added in the list of equipment. So regarding processing of blood components from whole blood by a blood center, regarding packed red cells, the pre-existing clause has been replaced by the product shall be known as packed red blood cells, that is packed RBCs remaining after separating plasma from human blood, which also include modified packed red cells, semi-packed red cells, washed red blood cells, leukoreduced red blood cells, irradiated red blood cells, and frozen red blood cells. So the types of red blood cells, that is saline washed, leukodepleted, irradiated, they all have been defined. Though in leukodepleted, they have given that 5 into 10 per 8 is intended to prevent febrile reactions and to less than 5 into 10 per 6 when required to prevent alloimmunization. So also they, in new amendments, frozen packed red blood cells, packed red cells aliquot prepared for transfusion to pediatric patients have been defined. The quality control criteria have also been put down. The previously it was only mentioned that they should be in compliance with the Indian Pharmacopoeia guidelines. Regarding platelet concentrates, the new clause which has been inserted include the types of platelets. Previously, platelet-rich plasma was not a type of component. Now it has been included. Random donor platelets. So this is the new components which have been included. Random donor platelet concentrate prepared from PRP or from Buffy code, and the pooled platelets have also been included. And they have given the definition and the justification of the pooled platelets. That is, pooled platelets may be prepared by pooling Buffy coats and then processed into 1 unit of pooled platelet concentrate. Alternatively, pooling can be done after preparation of RDPs by PRP or Buffy coat method. So the new amendments have also defined the shelf life of the pooled platelets and how to label the pooled platelets, and the expiry date of the platelets will be that of the platelet unit having the shortest expiry date. The platelet content in the pooled platelet should be at more than 2 into 10 per 11 per unit. And modified platelet components, including leukodepleted, irradiated, washed platelets, or platelets suspended in additive solution, have also been included in the new amendment. So regarding granulocyte, the original clauses have been replaced by granulocyte concentrate is prepared either by pooling multiple units or by apheresis as described under apheresis section. So they have also given the storage temperature and the shelf life of the granulocytes. Regarding FFP, the quality control criteria for the FFP have been defined regarding volume, factor VIII levels, etc. The excess and expired plasma may be issued for fractionation to the licensed fractionation center in the country with justification to be recorded in writing. This clause has also been included in the FFP. So regarding cryoprecipitate, concentrate of AHF shall be prepared by thawing FFP at 4 degrees centigrade in a cold room or blood bank refrigerator or in a cryobath. Also, they have given the specification that minus 80 degrees centigrade deep freezer should be used for faster freezing of plasma if it is intended for preparation of cryoprecipitate. Then the quality QC parameters for cryoprecipitate have also been included in the latest amendment, including the labeling requirements. So previously, the plasmapheresis, platelet pheresis, leukapheresis using a cell separator was given together like this. In the amended GSR, apheresis using a cell separator says the general requirement is, though the area is still 10 square meter, it mandates it should be air conditioned area. It shall be provided for apheresis and also for therapeutic procedures in the blood center. The equipment which are required and other emergency items which are required for apheresis, the list has also been included in the amendments. So criteria for selection of donors have also been included, and the time interval between successive apheresis as well as the tests that need to be done between successive apheresis has been included. In the types of apheresis, they have included plasmapheresis, platelet pheresis for harvesting platelet concentrate, leukapheresis for granulocytes, lymphocytes, and mononuclear cells, erythrocytopheresis, and hematopoietic stem cells. So the criteria for doing the plasmapheresis, that is, a total serum protein should be 6 grams per deciliter before the first procedure, and in repeat, it should be tested before the third procedure if done within a month. And the quantity of the plasma separated per sitting and per month should not exceed 500 ml or 1000 ml respectively.
Ma'am, may I request
Then
you,
the
please?
yeah, I am finishing in 2 minutes.
Thank you.
So the similarly for criteria of platelet pheresis have been included, and they have also included that the platelet pheresis includes washed single donor platelets, modified single donor platelets with replacement of compatible plasma, leukoreduced single donor platelets, and double single donor platelets. So this is the requirement of their shelf life and storage temperatures in the pH, etc. So leukapheresis, I've already said. So this is the last one. So they have also included therapeutic plasmapheresis and cytopheresis, and therapeutic apheresis activities allowed in the blood centers which are attached to the hospital, having apheresis facilities under the responsibility of registered medical practitioner, and who has obtained the consent of the patient, and the record of all this has to be maintained and signed by both RMP and blood bank medical officer. So with this, I'd like to end my talk.